Hello, and welcome to another episode of Young Black Mrs. I'm your host, Morgane F. And in this episode, I am chatting with my acupuncturist, Dr. Jennifer, and she and I chat about classic Chinese medicine and how that intersection can be beneficial for those that are suffering from infertility. So I kind of interweave my personal journey, and you may have heard it in previous episodes within this series thus far and within the season thus far. But she really geeks out, and I love it when people geek out with their profession. It's always exciting to see about how there's benefits from using classical Chinese medicine that can help you to reach your goals, whether it just be pain management or if you're wanting to help with infertility as well. So we chat about that in the main event, but I'm gonna slide you into a couple segments, and I may look different if you're watching. So just, enjoy the looks. All right, let's get into some segments. Shaking my curls. I'm shaking my curls. I'm shaking my curls. Shaking my curls. I'm shaking my curls. I'm shaking my curls. I'm shaking my curls. Shaking my curls. I'm always shaking my curls in a kind of way. Like, I'm irritated about this. But sometimes there needs to be a celebratory shake. And I'm going to shake my curls at the fact that I am about to hit my goal. If not, by the time you're listening to it, I've already hit my goal of breastfeeding for the time that I went to breastfeed. My goal was to nurse my daughter for 9 months. And why 9 months, you ask? Man, I don't really know. It feels like just like a number that sounded good in my brain. Like, oh, 9 months sounds good. 9 months in, 9 months out. 9 months on the boob, 9 months out. Oh no. Honestly, this is what I thought. Because I think some of the stuff I read, I thought, oh, maybe by that time the child will have teeth, and I don't know how I feel about that. And we're kind of getting to that point where I'm like, ooh, mm. But I am excited that I hope and plan to continue to pump or use the frozen milk that I have stored. And I am very proud to be able to do that. And I know that not everyone can nurse their child for medical reasons or whatever the case may be. Maybe that's just not their choice. Maybe they just want to use formula, whatever the case may be. Fed is fed. But knowing that I was able to reach my goal honestly at the beginning of the year, as we're coming in or in 2025, whenever you may be hearing this message, um, it's feeling like a celebratory shake. I don't get my curls out, but just imagine if it was out and swinging and banging and all this stuff. It would be wonderful. So if you have hit a goal this soon in the year, clap for you because that's major. I'm just saying. All right, on to the next segment. Hello and welcome to the main event. I have a special guest with me. You know what? I feel weird just calling you by your first name, so I'm not. Dr. Jennifer, say hello.
Hello, this is Dr. Jennifer Kung, and I have a doctorate of acupuncture and Oriental medicine. I have been in practice for 17 years now, and I'm the founder of Elements Acupuncture and Chinese Medicine. And I'm an acupuncturist and herbalist here, and I also have another provider here with, we got two assistants helping us out. And I've also, outside of the clinic, I'm a mom. I'm a wife. I've been married for 13 years now, and I have
Lucky
three
number
kids.
13.
Yeah, is that lucky?
Well, it's for Taylor Swift it is, I suppose.
Oh, yeah, that's true. All
I,
right.
I know you don't keep up with the pop culture.
Oh, I do.
Oh,
It's
all
very
right.
relevant to Kansas City than I am.
Well, yeah, Taylor Swift would be very relevant to Kansas City. That's very true.
Sure. Yes.
I'm so excited to have you on the pod. Are you in your office by chance?
I am. This is the front office. I don't think you've ever been in here. This is kind of where we do our like charting
No. No,
and
I don't think I've
studying.
ever been in there.
Yeah,
No,
it's
but
not a
that looks
treat.
beautiful.
Thank
Okay.
you.
I need to snoop around there a little bit more and see what's really going on.
We'll have to give
Well,
you the
yeah,
full tour.
I would like, especially since I've modeled, just,
True. You deserve it.
Yes. I think I do. Well, I'm so excited to talk with you about Chinese medicine and, the kind I feel like there's so many people that really appreciate Western medicine and the benefits that it has, but there's so many people that are looking for a more holistic approach.
Uh-huh.
And I know when I was on my search towards fertility or towards motherhood and going through my infertility journey, people were like, oh, it's kind of desperate to do something like that. It's kind of desperate to try something like that. Yeah,
Okay.
exact words. Yeah, but I was like, I don't really think so. I feel like it's very natural. I feel like
Hmm.
it's very like holistic, I really feel like you listen to the whole person
Uh-huh.
as in what you do for your profession. And
Yeah.
so my first question that I did not give you, but I often wonder just
Uh-huh.
from your experience, and I think about this with my chiropractor too.
Hmm.
I read your bio. I know you have so much education, but I often wonder because it's not Western medicine, do you ever feel like people are, lack of a better word, kind of look down on what you do in a certain way?
I feel like I think early on there was probably that sort of insecurity. But I mean, we get almost the same amount of education, in years wise, without, residency. But I feel like nowadays, we get people that are open-minded and are well-informed and that are seeking us out. And I feel like they respect our time and they respect our
Mm.
treatments. And so I don't feel like that anymore. And even now, I do feel like there is a level of, you know, Western medicine doctors are performing and physicians they're doing their job, and then we have our little area of expertise as well, and where we can help out also. Because I feel like Western medicine is really great for certain things, and I do think that Chinese medicine is really great for certain things too, and it kind of fills in some of the gaps I think that is lacking in conventional care.
Absolutely, I totally agree. So, overall, broad sense, what
Mhm.
are some things that you generally treat your patients with through Chinese medicine and herbs?
Mhm.
I love the herbs. I love the
Yeah.
herbs, girl.
The herbs are great. They don't always taste great,
No,
but
ma'am, they don't.
they're good for you. So a lot of what we treat is going to be pain, obviously, aside from that, but like in terms of women's health, it's going to be a lot of not just aside from like fertility issues, it's just like regulating cycle as well, helping with like menstrual cramps, endometriosis, adenomyosis, and just getting even like amenorrhea, if people aren't getting their period at all or not ovulating,
Mm,
we can kind of help kickstart the cycles back up and get those everything kind of functioning properly. And then other things like hormonal balancing and getting into like the more fertility aspect of it.
right.
We are helping more with like diminished ovarian reserve. People, if they have like lining issues during their different assisted reproductive therapies, and then high uterine Doppler, and as well as just like general stress, because that can definitely have an impact on
Mm,
fertility and just overall well-being as well. And then aside from that too, just the sperm issues as well. I know it's a little bit harder to kind of get the men to come in and get those things
yeah,
treated. But if you're treating the whole body, you're really benefiting all aspects of it. And regardless if it's, the male or the female. Because the end goal is we want both parts to be as healthy as possible so that the baby can be as healthy as possible.
absolutely. Would you say that the clinic currently has more dealing with more infertility or like that kind of treatment over maybe like the pain and the other things that you were mentioning? What do you say the percentages might be?
I would say currently probably about 60% fertility in women's health. There's definitely been more of a demand for it. And then like, 40% other, not just pain, but it could be like allergies, sleep,
Mm,
energy, just general wellness, digestive issues. So there's quite a few other
wow.
things that we'll treat within that 40%, but yeah,
Yeah, because I
primarily.
think I think when I'm thinking of like the cost of, and I know you do things in combination with infertility treatments like IVF and IUD, but I often
Hmm.
think of the cost of what IVF would be versus perhaps, taking or, having sessions with you. Like,
Hmm.
it's just like,
Uh-huh.
even if you needed a break in between, it's just, I feel like it's more reasonable to think. I'm
Yeah.
curious, like, what would you say are some of like the basic ways that Chinese medicine can help with infertility?
Um, Really, so when people come in for fertility, I really do say we're looking at your whole body. I want to know like all your symptoms too, so that we can really address everything to make sure that, everything is working as optimally as possible. Um, but for fertility and specifically, we're really working on getting blood flow to the uterus. We're really working on nourishing the blood. And each person's going to be different. So some people they're going to have more of like an excess type of issue, or they might have heat. Whereas most people, I would say most people coming in for fertility are going to have more cold, and tend to be more deficient. But you really have to address those specific things for each
Mm.
individual in order to do what's best for them. But yeah, in general, we're mainly just trying to help with blood flow to the uterus and really make sure that everything's kind of warm and make creating that hospitable environment for a baby.
One of the most interesting things that I found going through treatments was when you check the pulses.
Hmm.
And I was just like, I was so fascinated by that. I'm like, girl, what my pulses say? Girl, what are they doing today?
Yeah, sometimes they can be very telling, and then sometimes everyone, no matter what they're going through, will just have the same exact pulse. So it's like kind of frustrating sometimes if people are like, "Oh, what's my pulse say?" And I'm like, "Well, yours is like the same as it always says, not really saying much." But based off of the classical Chinese medicine principles that I've learned through my herbal medicine group, is is purely based off of pulses. Well, some abdomen too and symptoms, but it's very strongly related to the pulses. So, we're able to tell sometimes if you've like drank last night, or if you have a headache, or if you're like really stressed out, or have a low backache, like we are able to tell that from the pulse, because the pulse actually will reflect your organs and then your whole body and how everything's kind of functioning.
Interesting. I remember one time I was getting pulses done, and the guy was like, "You're tired, huh?" And I was like, "Well, you have a newborn, so I'll give you a pass. But I think, you may take a nap." I was like,
Yeah.
"Don't call me out. You know what's going on, friend. Like, don't call me out." It's so fascinating how telling that is,
Yeah.
And just to share my personal story, in being with you, you were like, "Your pulses are a little different this month. Are you gonna take a test?" And you were
Yeah.
right.
And the tricky thing is too, the pulse for like a period and the pulse for pregnancy is actually very similar. So it's really hard to tell. But I think with yours, since I had seen you for a while, I kind of knew what your pulses would do. And I was like, oh, this feels a little different.
Yeah.
Yeah.
Next month, boom. I was like, oh my God. So I feel like that's
Hmm.
yes, the actual component of the needles, and we can probably
Hmm.
talk a little bit about that, like what to expect in a moment. But I feel
Hmm.
like when you start out in that and you're doing the pulses, and I'm just like, oh wow, she's really getting a lot from me. The
Hmm.
biggest thing that I noticed about the differences between Chinese medicine and Western medicine, obviously, it's just so much attention that's
Hmm.
given,
Hmm.
and I feel like you've mentioned classic Chinese medicine, and I feel like a lot of folks are maybe familiar with, and I was too, traditional Chinese medicine. Am I going to blow
Hmm.
your mind if I try to ask you to kind of explain the difference?
Yeah, I mean, it's a little lengthy, but so traditional Chinese medicine was actually um, medicine that was kind of systemized into an educational system after the Cultural Revolution in China. So everything preceding that time, well, not everything, but a lot of the medicine before that time was kind of lineage based. So it was kind of passed down through families and learning. based off that like apprenticeship style. And classical Chinese medicine is actually based off of three major texts uh, that were around during 220 AD in China. And so these actually have kind of like the basic fundamentals of Chinese medicine, and then two of them have the the actual like formulations. Um, of different formulas and the herbs that are in them. And so it's pretty fascinating. But my teacher, Arnaud, he has a he was learning in China for a long time, and he's kind of brought a lot of his knowledge that he learned there and kind of has been introducing it to the students here. Yeah, it's all formulas that are based off of the Shanghunlun and the Jingui Yaolue. And so it's really cool to be able to take these ancient formulas and then be able to apply them to modern times. And, doing that often, not oftentimes based off of pulses. So it's really cool and fascinating. So all the classical, like it's also called canonical Chinese medicine. So those are all based off of the three canons. And then anything that's traditional Chinese medicine are actually more modern formulas. So there was all these
Hmm.
different school of thoughts that arose during that time. And so each school has kind of like their own ideas and thoughts. And so they've kind of created their own formulas out of the different herbs. So these are seen as more like modern formulas that maybe haven't been tested quite as long. But they're still, I think both are effective in their own ways. I've just found the system that I use to be a little more precise.
Yeah.
That way, when you like take the pulse, you can tell what's going on with the person at that time, and then really like pinpoint a formula that fits them during
Wow.
the time. So, and oftentimes I feel like people get like pretty fairly immediate results. You can tell when you take something, like you can tell whether or not that formula is helping. And I think with traditional Chinese medicine, sometimes they're like, well, you might have to take it for several months in order to
Right.
feel anything. But I feel like with the classical Chinese medicine, then you can really like feel a difference almost immediately.
Because I think for me, I started dabbling in acupuncture because I suffer from mental health stuff, right? I was
Hmm.
diagnosed with bipolar, I don't know how long ago, forever ago,
Hmm.
I don't know. So I started doing acupuncture to kind of help with my headaches and stress and kind of stuff
Uh-huh.
like that. But it was someone that did acupuncture and chiropractic, and
Okay.
it wasn't giving, yeah, you're giving that look. I know what that look means.
No, it's
Don't,
okay.
yeah,
There's definitely a place
I
for that too.
Right, but I just feel like, okay, so I saw that gentleman first, and then I saw
Mhm.
another gentleman that I'm pretty sure was doing more. He was doing acupuncture and chiropractor, but I feel he would put ginger on the pressure points before he put the needle in, and them joints was
Oh,
that was hot, girl. I was like, okay,
interesting.
this is something different, and I was like,
Uh-huh.
ooh, yes. But then he would do like an adjustment after the acupuncture. And so I was
Hmm.
feeling very, very acu-drunk, relaxed and stretched
Hmm.
out.
Hmm.
But it just, I feel like I don't know if I don't know what happened with that. I didn't stay with it. Like, oh, I kind of felt like he was nickel and diming me a little bit. I think that's what it was. And I didn't
Oh.
like that. It kind of felt
Hmm.
kind of hustled a little bit. And
Mm.
so when I found elements, it was just
Hmm.
like very personal experience, very customizable experience. And that's what I really enjoy about, your clinic, I suppose.
Hmm.
I want to talk with you a bit more about a patient's experience. I mean, obviously
Uh-huh.
I can speak for my experience, but
Hmm.
I know I used to ask a lot of questions because I'm like, girl, what you doing? What is these posters? Because I wasn't familiar with that based on the two doctors I went to that were chiropractors and then,
Hmm.
also
Oh
did
yeah.
acupuncture. So
Hmm.
it was a very, and now kind of hearing the difference between, and I never had formula. The first time you said that, I was like, what is this? You
Like I'm a
know,
baby. I'm drinking some drinking some
girl,
corn.
I didn't know what was going on. So could you kind of share some of the general, I guess, components that you use? My favorite, the Moxie,
Uh-huh.
those kind of things.
Yeah. So I think outside of outside of fertility, just in general, we will do acupuncture, herbal medicine, cupping, moxibustion, and even electrostimulation, and also gua sha. So there's quite a few tools, which is gua sha is this great. Well, everyone's familiar with the facial gua sha, so I think everyone knows
Yeah.
what that is. But aside before there was facial gua sha, we would do it like on the body, and it would be, pretty intense. You're trying to get that redness to kind of scrape up on the skin. Um,
Wow.
yeah, so those are the main different therapies that we'll use. And it's all just based on what the person needs. Not everybody gets moxa, not everybody gets cupping. So just yeah, it depends on each person.
So when it comes to the needles itself, do you ever
Hmm.
count how many you're putting in just for
Oh
funsies?
yeah. No, not for funsies, for official official charting purposes.
Oh,
Um,
really?
yeah, we got to count them and then make sure we pull out that amount so we're not leaving any needles in. I know everyone's like,
Yeah.
"Do you really want it?"
Someone used to say to me when I said, "Oh, I get acupuncture," they're like, "Well, don't drink any water afterwards because you're gonna have hole." I was like, "Girl, they're taking them out." But yeah. So would you say the most standard thing would be the acupuncture needles?
Yeah, for sure. That's
That's what
definitely the most common thing that people are coming in for. And on occasions, I'll have some people that only come in for like an herbal consultation. But I feel like in our society, most people do well. Well, those that are outside of those that are scared of needles, most people do well with getting the acupuncture treatment. I think it's a little bit harder of a concept for Americans to take the herbal medicine, and takes,
yeah.
a special person to be able to take them and take them consistently.
So we talked about some of the treatments that people can expect with the needles, the moxa, cupping perhaps, which I wasn't a fan of. So when I'm just being honest, I mean,
No, it's
it's because
great.
it was
It's
the
not for
marks.
everyone.
It was the marks. The
Uh-huh.
mox is my favorite. So
Hmm.
because it was just so relaxing too.
It's
Um,
warming. It's really
oh,
nice. It's
but like
nourishing.
when it comes to being able to provide like a well, kind when it comes to fertility,
Hmm.
or is there some kind of standard of those tools that you typically use?
Hmm. I would feel like, yeah, most of the time we'll be doing acupuncture and moxibustion for those that tend to have more like cold in their bodies. And then electrostimulation too, we'll use on the abdominal points to try to just help increase blood flow to the uterine area. So yeah, those are probably the more common ones, and if people come in and they're like, I'm so stressed, my neck and shoulders are tense, we'll do cupping on them too. So I feel like our treatments aren't always like, you know, so specific that we're not addressing some of the other concerns. So I think the main thing too, we want you to be like relaxed and comfortable and being able to like just continue on with whatever, sort of therapies you're doing for fertility.
Right, because I think about how strict particularly IVF, how strict those things are. This medication, this time, these shots, this
Hmm.
time, blah, blah, boom. So having something that's really like customizable to you. How do
Hmm.
you go about deciding about the herbs, when to incorporate them, and that sort of
Hmm.
thing?
Well, I think that was one of the difficult things with women who are going through IVF. And sometimes not. I think it depends on their reproductive endocrinologist, but sometimes we're not allowed to do herbs. And it's really challenging because I'll feel those pulses and I'm like, I just want to give you like some blood. I just want to nourish your blood and really get your like energy boosted, because they'll be so weak, and then you're pumping them with all these like meds to stimulate them, and I feel like their poor little bodies are just like screaming for help, and I can't. That part of my area has just been like severed, like I have no access to the herbs, and so it's hard to do that. But at the same time, I understand what they're doing, and have confidence in the treatments and the meds that they're given. So I respect that. But I do love it when I'm able to do the herbs and help them out in a different facet, because acupuncture can only go so far. I mean, it still has great effects on the whole body, like vasculature and nurture, like, and even with the organs and the everything. So there's definitely, acupuncture definitely has effect on the whole body. But it's like, if you're blood deficient, like you can stimulate those points that nourish blood all you want. It's not going to like build the blood up to the point where you know that you need it to be beneficial. So that part does get a little tricky. But in terms of deciding what to give people, it's really, based off of their pulses and symptoms and kind of our findings for that person, and really addressing. And sometimes too, there's like a progression. A lot of times with the herbs, we're not just giving the same formula the entire time. Your body's changing, so your pulses are going to change, and so we're going to be changing what they need during that time too. So.
Well, you kind of got a good segue into one of my other topics about Chinese medicine, traditional Chinese medicine, and Western medicine, and kind of like
Mhm.
how they may complement each other, and it seems like how they may crash
Uh-huh.
sometimes. What are your
Mhm.
thoughts?
Oh, I don't think there's necessarily any crashing or clashing with them. I think it's more just about what, we're allowed to do. Because actually, in some clinics too, that some actually do let you do herbs. And sometimes I've done herbs up until, transfers or,
Mhm.
through IUIs. So I feel like, in that way it's been really nice. Um, what was your main question again?
Oh, just wondering about the how you're kind of blending them together, how they have a complementary approach.
Uh-huh. But yeah, the acupuncture, we're able to, apply that to any situation really without having the REs, have any conflicting interests with the herbs and how they're interacting with the meds. But so that's great. I'm glad that we're able to see patients that are going through that regardless. Yeah, so that's
Do you
really
think
nice.
that's shifted over? Do you think that's shifted over time? Because I remember my clinic was like no herbs.
I think, and most of the time when we were doing it was when you were kind of like struggling with other things or like in between
Yeah.
cycles. But yeah, there are some that, they found research with this particular formula that was helpful for a quality and kind of helping with. I think it was more of like women who they've like tried a lot of things and nothing seemed to be helping. So they're like, okay, here you can also try, you can try the herbal
Yeah.
medicine and, we'll let you take it, even with the meds. So yeah, it just kind of, it depends on the reproductive endocrinologist, I
Hmm.
think.
Yeah,
Mhm.
because I feel like if you're real old school, you're just like, what is this? Again, back to that stereotype that should be could clearly debunked,
Mhm. Mhm.
because there's benefits, right?
Yeah.
We know we see,
Oh yeah.
obviously you see it every day because you're working it.
Hmm.
Um,
But I think it's
but
hard for them to know. They're not aware of, I think,
right,
the full benefits of acupuncture and Chinese medicine. So yeah, and then what you don't know, you fear, immediately at least. So, but yeah, I think it's coming around.
absolutely. And speaking of which, that's one other thing we didn't talk about, and I think this kind of would be a good way to round out our conversation. It would
Hmm.
be like I know everyone's that may be coming to see you for fertility reasons is they're obviously dreaming of that live birth,
Hmm.
that was the goal of mine, like
That's the
the
end goal.
dreaming of the live birth. Right, that's the
Hmm.
end goal. But one of the biggest things that I thought of going through my motherhood journey was like, and
Hmm.
I've told you this, just being able to relax in there. It's like
Yeah.
an hour or three, depending on how long you want to be there.
No, it's not true.
No, it felt like it though.
Yeah,
But
it's true.
yeah, because I was not okay.
Yeah,
I was in a
yeah.
good sleep, but depending, just having that time to myself to just be able to remain calm, just be able to
Hmm.
remain
Yeah.
relaxed, really
Uh-huh.
relaxed. I know
Hmm.
that was one of the main benefits that I received. Also, formulas. I never forget. Like I had COVID one time, and I know this is whatever, but you gave me something that just really cleared my throat, and I was like,
Hmm.
girl bottle this. It's like the
Good.
phlegm or something. I was like,
Yeah.
whoa. I think
Hmm.
that because I too was a little skeptical of the of formulas. I'm like, I don't know about this. I
Hmm.
don't know. Just give me the acupuncture. But then that one time I was like, wow, okay, yes. Formula me up. Thank you.
Like
Formula me
sold,
up.
I'm
Thank you.
sold.
Yeah.
One
And
one interest I do have an interesting story about that and fertility if you want to hear it. I had
yeah.
one patient who she was getting ready. I'd seen her for maybe 6 or 9 months, I think. And she still wasn't pregnant. And I think people at that point, they do start to get a little bit discouraged because it's like, oh, I've been seeing for a long time, like still not pregnant. So she was already kind of on track to do IVF and transfer. Was she doing transfer or retrieval? I think it might have been the retrieval, but she was kind of on track already to do IVF, and she got COVID, and so she ended up having to cancel that cycle. And I had treated her. I gave her herbs during that time that she was sick, and then really soon thereafter, she got pregnant on her own. But I always feel like it's right when like women are about to like lose, their endurance and their confidence in Chinese medicine. I feel like it's always when they're like, I don't know if I should continue, and then they always get pregnant like the next cycle. So it's always
That's
funny.
I feel like that's kind of like my story I was in the break between another cycle and I
Mhm.
was like okay well because the place I was going to they're really booked so I had to wait and
Mhm.
I was taking treatments with you and and that's when you checked my pulses that one day you were like go take a pregnancy test and then I got my period the next day but then you were like no like it's different like
Uh,
keep going and then the next month hello did you know that story, right? So I was like,
yes,
oh wow. And then it was so sweet. You were just
love
like,
it.
I'm not getting too excited. We're just being cute. We're not getting too excited. Have you got the ultrasound? I'm not getting too excited. It's like, okay. I was like, because it baffled me. I'm like,
Yeah.
it's just, I was like, wow, are you serious? Like,
Yeah. And that's one thing too that I wish people knew. Like I feel like nowadays people are pretty quick to like jump into doing IVF, and I feel like if they just stuck out with Chinese medicine, that they would eventually get pregnant naturally. But I understand a lot of women are on like a short, time crunch, and they're feeling that urgency, and I understand that. And it is easy to like lose patience with that thing, but patience, not patience. But I feel like typically, usually we like to see people like for fertility at least 2 or 3 cycles weekly for 2 or 3 cycles. And there are some outliers that will just kind of actually get pregnant during that time. And then typically, I feel like more commonly people probably the range from like 6 to 9 months if they've been seeing us consistently, they will usually get pregnant during that time. And then there are some that will take like a year or longer. But even like you were asking or you had mentioned costs before, like someone had came for, a year before they got pregnant. And I calculated it all out. And well, roughly speaking, I think it ended up being, like 5,000 for like a year. But it's like, obviously IVF is going to be a lot more costly than that. So
yeah,
I think it's
could
also
be in the
just,
tens of thousands. Yeah.
yeah. So it just depends on, mainly, I think your time and urgency,
Right.
with the matter. Yeah.
Absolutely. Absolutely. I'm trying to think if I've covered everything I wanted to chat about. Let's see. Do you have anything else you want to add to this conversation?
Well, I don't know how much time do we have left. I could, I could go on and on and on.
Girl, it's your show. Now, Jennifer, I'm just here learning. I'm just here learning.
I think that was a lot of it. I mean, I think the part we didn't quite go too much into is more like the basic principles and
Yeah.
um, which is, that could take a really long time as well. But the basic principles of Chinese medicine is going to be yin yang theory, and that can be applied to so many different things, whether it's the menstrual cycle. There's like a cool little image of like a yin yang with like the menstrual cycle, where the blood is starting to build up, and then that's going to be your yin. But everything is going to tie in with that, and you can break every diagnosis, every issue down to like yin and yang. But the other types of methods that we use for diagnosing are going to be the 5 elements, which is our namesake, but the wood, fire, earth, metal, and water, and then those are all associated with different organs, and that's kind of how TCM actually will do their organ diagnosis and find out syndromes that are related to that based off of each person. But the thing that I love most about Chinese medicine, how it just ties everything in with like nature, and it's really, I think it's just really fascinating and beautiful, whether it be like how our bodies are connected to the world and how it function, how it'll function based off of like the moon phases or, and just how our different acupuncture points they're all named based off of, different environmental happenings, like valleys and lakes and streams, like they're all kind of based off of like things that you would see in nature. So I think it's just really beautiful how it ties in, like our bodies tie in with nature. And um, I think it just reflected in our whole like cosmic system, with the world and us in it. And so
Absolutely.
it's really beautiful.
I think that's where it comes back to the holistic component of it and really just kind of
Exactly.
taking from the earth and having it heal you. When I was thinking about one thing you were saying about how it being such an ancient practice, it's like, your ancestors who
Hmm.
have this component that was able to heal people way back in the day before we started doing all
Hmm.
the types of strange things. I always think about that, like this the healing process that just I always be like, God gave us everything we need on this earth to be able to protect and care for ourselves. I feel like it was the creator did that by design to really be able to help
Yeah.
heal us. And so we utilize it, and that's what doctors are for of all sorts to be able to push us towards the right direction. I used to say,
Yeah.
if everyone was like me, it'd be great. But then I realized I have some gaps in my knowledge. I can't do what you do or any, other folks do. So we'd be stuck
Uh-huh.
here in one direction.
Yeah, I love it.
Awesome. Okay. Well, I can't let you go without playing a few games of Marry, Date, or Dump, a few rounds
Okay.
of Marry, Date, or Dump. And I've been thinking of some stuff in my
Oh, a
head.
few rounds. Okay. Okay.
A few, yeah, like a few is like two or three. I
Okay.
got one in my brain. Okay.
Okay.
So
Okay.
the
Listening.
first one, because your
Uh-huh.
shoe game is always shoe gaming, all right? So
Oh,
which one you marrying, which one you dating, which one you dumping?
okay.
A high
Okay.
heel,
Oh,
a flat,
uh-huh.
or a sneaker?
Oh. Hmm.
I feel like I
Okay.
know which one you're gonna dump.
The heel one's easy. I'm dumping that.
Yep,
I'm
that's what I thought.
dumping the heel. I will. No, I'll date the flat, and I will marry the sneaker. Yeah.
Okay, even though you wear
That too
flats
obvious?
every day. All right.
I know that was hard because I do love flats. I do love flats, but I feel like outside of the office, I don't really wear flat. Like I wouldn't wear closed-toed flats. I wear flats, but not, dressy flats.
Gotcha.
Mm-hmm.
Okay. Now I'm gonna try to we just have
You
to
got another
group.
one?
Yeah, I've got two more in my head. We could have the group two of the seasons together. So like I feel like summer
Oh.
and spring are kind of, so we'll just put them
Mhm.
together. So
Okay.
fall,
Mm-hmm.
winter, or spring, summer. Which one you marrying, which one you dating, which one you dumping?
Oh, that's so sad. I love them all. I love all four seasons very, for a short amount of time. But I
Because that's
will.
all we get in Kansas City.
I know, I know. I'm definitely marrying fall. That's my favorite. My birthday's in it, and I love everything about it. I love the leaves turning colors. Although I do love aspects of winter, I'll probably have to dump that. And I'll date spring and summer.
Okay, and one last question for you,
Okay.
because I know you spent some time in the Bay.
Hmm.
So, which one you dating, which one you marrying, which one you dumping?
Okay.
Hip hop,
Mm.
like 90s R&B,
Oh,
or
90.
like
Okay. Thank you for
yeah, like
specifying.
yeah, like just hip hop
Okay.
90s R&B, or
Hmm.
like let's just say like 2000s pop.
2000s pop.
Yeah. Like that
Okay.
was like Britney Spears era. That's your era. You know that.
I don't think that's my era.
I would
Well,
I think it is.
well, yeah, maybe. Okay. Out of those two,
No, yeah, hip hop, 90s R&B,
oh, hip hop. Okay.
2000, yeah, 2000s pop.
Can it be like 90s hip hop? or just
We
hip
can
hop
do
in
that.
general?
We could do that. We could do 90s hip. I should have specified. I specified everything else. You're right. We gotta play evenly in this game. That's true.
Okay, okay. Um, I can go without 2000s pop. I mean, I love music. I love all music, honestly. So that one's hard too. I love everything. I know that's not really fair. But I'll dump 2000s pop and I will date 90s R&B, but I will marry 90s hip hop.
I knew you would. I knew you would. You
I
from the
know,
Bay.
I love it.
Or you stayed in the Bay.
So
I knew
good.
you would. You spent some time there, so I knew you would.
Yeah.
All right, folks. Oh, Dr. Jennifer, it's been wonderful chatting with you.
Yeah.
We're gonna go to the positive tip for Dr. Jennifer. You stay there.
Okay. Thank you for having me on.
I forgot to do the positive tip. So the positive tip. We spent so much time talking about how frustrating, not so much time. We spent a little bit of time talking about how frustrating this whole infertility journey can be. And I feel like the biggest thing that I took away from the conversation is this means this ancient method has been doing what it's supposed to do, helping women, helping people in general, but in the frame of infertility, helping women get to their goal of motherhood, right? I believe I am one of those people, but it's not without consistency and it's not without patience. And I feel like that's maybe the well, even I feel like with IVF too, it's not like a boom. Um, but if you're able to withstand the twists and turns and just be patient, I feel like you're going to eventually hit your goal. And I feel like that's with a lot of things in life. It's just like, oh, ye of little faith, just wait it out. The timing is going to present to where you can be where you want to be. So I thank Dr. Jennifer for chatting with me and for you guys listening. If you've made it this long in the video, please make sure you subscribe and follow. And if it's been impactful to you, share it with someone that is on a motherhood journey. And for my listeners on your favorite podcast, thanks so much for listening. You can share this podcast with someone that would appreciate it. And honestly, until next time, peace.